Hi, I'm Tasia Hartley, and today I'll be performing a central line dressing change. Before we begin, we're going to verify the provider's order, gather our supplies. Hair is pulled back and secure, no jewelry on, nails are clean. We're going to wash our hands and go into the patient's room. Hi, I'm Tasia, and I'll be your nurse today. Can you please tell me your full name and date of birth? The patient will use 2 patient identifiers. Is it okay if we perform your central line dressing change today to prevent infection? We'll obtain consent from the patient to perform the procedure. Then we're going to close the curtain or the door for patient privacy, and then we're going to put on our mask, ask whoever is assisting us to also put on a mask. We'll ask the patient to put a mask on as well. If they refuse, we'll just have them turn their head away from the insertion site during the procedure. Then we're going to put on, do our hand hygiene again. I'm going to put on our gloves. Before removing the dressing, we're going to we're going to, before removing that dressing, we're going to look at it and palpate for any signs of infection. So we're looking for swelling, tenderness, warmth, any signs of subcutaneous fluid. Once we do that and we look and we don't see anything, we're going to stabilize that catheter with our non-dominant hand. And then we're also going to carefully remove the dressing. We're going to pull each corner very slowly, parallel to the skin and away from the insertion site, because we want to avoid accidentally dislodging the catheter. Once we discard the old dressing, we're going to inspect the skin again for any signs or symptoms of swelling, tenderness, warmth, redness, any signs of infection. While we're doing that, we're also going to be inspecting our catheter also to ensure that it's patent. So it's secure, there's no kinks, it's intact. So once we do that, we're going to remove these gloves, perform hand hygiene, throw them away. Then we're going to open our sterile dressing kit and remove our sterile gloves. So I'm just making sure that I don't touch the outside of the sterile gloves so that they stay sterile. Once we get these on, we're gonna get the chlorhexidine out of our sterile kit, and we're going to activate it and allow the sponge to become fully saturated. Using the sterile gauze, we'll stabilize the catheter and we'll cleanse the insertion site with the chlorhexidine, using the back and forth friction scrub for at least 30 seconds. So we'll clean the area approximately the size of the new dressing, while also cleaning the catheter and the tubing above and below the insertion site. We want to allow the chlorhexidine to dry completely. We're not going to fan it, we're not going to blow on it or wipe the area, because then it would contaminate it. So we're not going to do that. So this is our chlorhexidine. We're going to activate it, let it fully saturate, and then, like we said, that motion, 30 seconds, back and forth friction, the size of the dressing. Then we're going to let it dry. And then once we do that, we're going to take it's completely dry. We're going to take our new dressing and we're going to put it over the insertion site. We're going to get it as smooth as we can, and we're going to eliminate any wrinkles or air bubbles. We're also going to put the date the time, and the initials, our initials on the dressing, because we want to ensure that whoever comes to change the dressing after us, you know, they're able to see the date, the time, and place it on the edge of the dressing according to the facility policies. We're going to discard all of our used items. We're going to remove our gloves. We're going to remove our mask. We're going to ensure that the patient is comfortable, place the bed always in the lowest locked position, and then we're going to make sure that the call light is within their reach. And we're also going to do our hand hygiene. We're going to document everything that we did, the dressing change, including the condition of the insertion site, the type of dressing that we used, the patient's tolerance of the procedure, and any abnormal findings that we may find. And that's it. Thank you so much.